EMQ Families First is a nonprofit. We are one of the largest children's mental health providers in California, and we serve 20,000 children and families annually.
The Electronic Health Record, or EHR, is an agency priority initiative. We recognize the EHR as a critical tool in serving our families. Efficiency translates to more time with families. Interoperability translates to reduced cost and a more comprehensive view of the child.
We had several clinical challenges prior to the implementation of Welligent. The biggest one was that our service providers were having to take time when they wrote a note to have to print it out and hand sign it.
Billing in particular in the state of California is quite complex, and for us as being multi-county, multi-payer, we have a lot of diverse requirements.
We also had a lot of duplicative data entry. As a clinician, I might fill out a form, I handed it to somebody else, they had to input it into a system, and every time there was a change in whether it was at intake, at transfer, when there was a change in client information, there was this duplicative process.
A number of things differentiated Welligent. The cost, the user interface, the technology framework, and of course the relationship established with Andy and Chip. Chip was able to provide solutions for every single challenge we posed to him.
Well, the team that tested out the system involved service providers, supervisors, and all managers. And so we were very invested in making sure there was the easiest use of the system for the service providers.
The Welligent implementation team has been awesome. They're really responsive. They don't get frustrated when we ask the same question more than once. They provided us with the system early so that we could learn it and work with it in a sandbox environment, which really helped the interviews, helped us to understand the level of configuration we actually had control of within the system.
The clinical team experienced several positive impacts upon implementation of the Welligent system. The first and foremost was the call center functionality. It really speeded our process in access to care. Together with the Welligent email system, we created a method for immediate communication with service providers as we assigned cases.
The user interface of Welligent has allowed our team to come up to speed quickly. Our end users are able to learn the system and interact with it quite quickly. One of the key tools that we really relied on at the time of go live is a report that allows program to partner with billing to identify and resolve billing issues, as well as to identify and resolve configuration issues at go live. We've integrated our outcome tools into the clinical documentation where it makes sense within the clinical workflow.
It has allowed us to dream a little bigger. We're going to be able to use the responses to directly inform the treatment plan, to suggest treatment goals for us so that we can move forward more efficiently with families.
So Welligent has positioned us to be able to interoperate with our payers when they are ready. Welligent has experience in California, specifically with LA County, and they have made themselves available for consultation to other counties.
By providing our direct service providers mobile access, we hope to increase the time our service providers are with families. And we also want our families to be more involved in the system. We want them to be able to participate in collaborative documentation, their assessment, their treatment plan.
We are in the process of designing a dashboard that we will collaborate in building with Welligent. It includes dashboards for the service providers so that they can monitor progress of treatment. It includes dashboards for the supervisor to use in clinical supervision.
Together with Welligent, we have been able to create a clinical record, a workflow, and a communication system that supports our direct service staff in providing timely, individualized, needs-based, and outcome-driven services.
I would recommend Welligent to my colleagues for a number of reasons. The user interface, the technology framework, the relationship that we've been able to establish with our implementation team, as well as Andy and Chip, has just been wonderful.
My name is Elena Judd of EMQ Families First.
I am Rachel Clausen with EMQ Families First, and we chose Welligent.